Thyroid cancer is one of the top 10 most common cancers in the United States, and unfortunately, it's on the rise more than any other cancers. Tonight, ABC 27 is going in depth with Penn State Health's experts in a special program, Thyroid Cancer, a Matter of Facts. Dr. David Goldberg and also Dr. Goldenberg join us to give us a better understanding of the cancer ahead of the web chat too. So I was saying, you guys are really busy. You're doing Good Day PA, you're doing a web chat, you're doing a special tonight. Let's start with you, Dr. Goldenberg. What is thyroid cancer? How many people does this affect? As we just said, it's really growing.
Well, the thyroid gland is a gland that sits at the base of the neck and controls our body's metabolism and heart rate. It's kind of our body's thermostat. Thyroid cancer is when it's invaded by malignant cells that aren't supposed to be there. And thyroid cancer is on the rise. It's rising quicker than any other type of cancer out there. Any
explanation for why? Do you know?
Well, part of it has to do with overdiagnosis, and part of it is probably a real growth in the rate, reasons of which we're not sure right
Interesting.
now.
So, is it something you can feel as a patient? Like, are there symptoms that we should be aware of?
Typically, thyroid cancer is found incidentally. It has no real symptoms, but sometimes there's a mass in the neck, and a patient's primary care physician or gynecologist will find it.
Interesting. So we mentioned it's on the rise, and we're not totally sure why, but are there certain risk factors that you've been able to identify over the years?
Well, the biggest risk factor is being a woman. Women are afflicted by thyroid cancer 3 to 4 times more than men.
Wow.
And other risk factors include iodine and external beam or accidental exposure to radiation.
Oh my gosh, that's scary to think about too. But of course, we like to encourage folks, there are treatment options. You're going to tell us about that, Dr. Saunders.
Sure. The treatment for thyroid cancer is almost uniformly starts with surgery, taking out the thyroid gland and the cancer and any involved lymph nodes. Occasionally, depending on the specifics of the thyroid cancer, we use other treatments such as radioactive iodine therapy, or more rarely external beam radiation or chemotherapy. But largely it starts with removal of the thyroid gland. You
have to remove the whole gland. How does that work? Because the thyroid helps your metabolism. Is that right? Am I right about that, or am I making that up in my head?
No, that's absolutely correct.
I'm right about that.
So after you remove the thyroid gland, we place patients on thyroid hormone replacement. There's been long-standing use and it's very safe with thyroid hormone replacement. So it's a medication that you're on for life after thyroid cancer surgery. And it's something that we monitor levels of in collaboration with our endocrinology colleagues.
And besides all the treatment options, there are also some resources that you can offer patients to help.
Absolutely. Thyroid cancer itself, in general, has a very good prognosis. But as with any cancer, it's very important to have a strong support system and family system. At Penn State Health, we've recently begun a chapter of the Thyroid Cancer Survivors Association. It's a patient-led advocacy group. It meets the third Sunday of every month on the Penn State Hershey campus.
Great.
And that's available for patients and their families for support.